right. Hello. Good afternoon, everyone. I know that you will be joining here in a moment.
Hi, everybody.
A very good afternoon to you. Kristin and I are joining you today from Boulder, Colorado, where it's a little smoky, but we're managing. It's a beautiful fall day. So we'll just wait for a few more minutes while people are dialing in and getting situated, and then we'll start with our conversation. Thanks so much for joining us. We're very excited to talk with you about what we learned, about how that might be relevant to you and your business, and we'll go from there. As you're joining, we have a poll question that we would love to ask you to participate in. So there's the poll. And so the question is, what is your awareness of the HLTH or health conference? Have you attended this? Did you attend it this past year? Have you attended it in a prior year? Have you heard of it but never attended it before? Or is this the first time you're ever even hearing about it? So just take a moment and let us know where you are with this, and then we will, gauge our conversation appropriately based on your potential awareness, and we'll go from there. Excellent. So one more housekeeping note. We deliberately called this a conversation, and I'm hoping that you'll see that both Kristin and I are going to be having a conversation with each other. We do have some slides just to guide our discussions, because there's so much that we learned and we're so excited to share it with you. And we would love it if you would also participate in the conversation. So the Q&A box that's down below in the Zoom, sorry, so many different systems, but in the Zoom control box, there's a Q&A box, and please feel free to use it. I'll be presenting the slides, and Kristin's going to be monitoring that box. And so as the questions come in, we're going to, address them. So please join in the conversation. We'll love to have you. Okay, let's take the poll away and see where everyone's awareness is with, and share the results. So, okay, so the majority of you, 62% of you, have heard of the conference but have not attended. One of you attended the Health 2020 conference. Great, we were there too. Nobody attended the prior year. And then
we did.
33% have never heard of the conference before, which is okay. You're still in good company, because what we're going to talk with you about, hopefully, is really resonant and relevant outside of this conference, or even outside of healthcare provision. And so let's dive in. Let's go ahead and close that, and we'll dive in. So let me start by introducing myself, and we'll go from there. My name is Hamid Ghanadan. I'm the founder and CEO of Linus, which is an insight strategy and innovation firm focusing on the entirety of life science, healthcare, and wellness continuum. And I'm joined by my colleague.
Hi, everyone. I'm Kristin Apple. I'm the president at Linus, and I'm thrilled to be here today sharing what we heard from the big health conference this year.
Absolutely. And some of you who may know us know that I come more from a sort of science background, and Kristin comes more from a healthcare background, and we have found this partnership to be amazingly powerful. And we'll discuss why that is. And so you may hear us talk about it through those different lenses, but generally speaking, we're going to be talking about it as a whole, from a holistic perspective. So first, we'd love to talk with you about why you should even care, and why this conference, and it's not really about the conference, and we'll talk about that in just a moment, but why you should care. And then secondly, we'd love to share with you two undercurrents that are really shaping the future of everything that we heard and we sensed in participating in this conference. And then the virtual conference experience as well. I know a lot of marketers who come to us all the time and asking us about, what is going to happen to the future of conferences? Are they always going to be online? What was the experience like? And we'll share some of that information with you as well. And, again, like I mentioned, we're happy to have a discussion at the end, but we're also happy to have a discussion all the way through. So please don't be shy and use the Q&A, and we'll take it from there. Good? Excellent. So why should you care? So the HLTH conference, or the health conference, I believe this is the third year that they had it. And clearly they were not planning on having it virtually. They were planning on having it, in a physical location. And in 2019, when Kristin and I attended, it was in Las Vegas. This year, the theme really for the conference, or the theme for the agenda, was the year everything changed. And so, as you can imagine, there's a lot of talk and a lot of conversation around COVID and what happened and so on. But really, there was other things that were happening before. The reason why Kristin and I really like to go to this conference, and the reason why we believe that this conference actually signals what we are doing and where we're going and where the future's going, is because we're firmly rooted in this belief that the future of health is actually the future of everything. And you can look at a cell phone today and think of it as a communication device, or you can look at your cell phone and think of it as your nurse. And these are the types of conversations that are happening within this conference, where it's not really that uncommon for this to both be a bicycle and a medical device. Those are not unseen or unheard of questions within the discourse that happens at health. And so we actually believe that the future of health is the future of everything. And we live in this century right now where the human well-being is at the epicenter of every conversation. And health and wellness is really rooted in nearly everything that we do and everything that we talk about. You would not believe how many different industries Kristin and I talk to about health, whether they have a health strategy, or they want to get into healthcare, or they need a healthcare strategy. And we actually do believe that the companies and the organizations who shape tomorrow's health journey are actually going to dominate the global economy. And so that's why this conference is also so important for us, because it's really the nexus of where everything comes together from that perspective. So we dove in.
You can see that from, oh yeah, go ahead.
No, go right ahead.
I said, you can see that from the sponsors of the conference and who is on stage. We have, the Googles, the Amazons. Of course, we have Kaiser, we have Sony, we have Bose, we have CVS and Rite Aid, but Bank of America. We had Comcast, industries that aren't traditionally associated with health. Everybody's there. Everybody wants to get a word in. And that was the same exact thing that happened this year. And we'll share that in a minute.
Yeah, absolutely. I mean, brands that you may know from very, very different parts of life. Best Buy was there last year. MasterCard, what are they doing in healthcare? But everyone has a stake because of this. So the blurry boundaries actually create new opportunities, and that's why you should care, because what happens at a conference like this really signals what happens in many parts of our future. So Kristin, let's actually talk about what we learned and what are these undercurrents that we picked up. The main themes that they talked about were around redesigning care, obviously. And this is really just the uber topic that the conference was based on. But there was a track and a lot of discussion around women's equality, mental health, and then also social determinants of health. So things like your neighborhood, socioeconomic status, race, diversity, and ethnicity. It was a pretty rich discourse, I would say. Wouldn't you agree that they really reached out to really bring in a more holistic view?
They did, yeah, even better than the year before. There was a lot of representation across a lot of different needs and industries and types of people. So it was really, really well done from that perspective.
So now let's actually talk about the two undercurrents. Let's talk about the first one, actually, that we noticed was happening.
Yeah, sure. And so again, we want this to be a conversation. So I know that we have people dialing in from all around the world, and whether you're eating lunch or having dinner or just hanging out at your desk, please type a question. Don't worry, we're not going to judge you. We'd love to have a chat throughout this. So that's the first theme, and it's a big one, and it will change the way that care is delivered today as well as in the future. And this is really understanding and exploring the gap between care and consumers, and specifically focusing on that last mile of care. What do we mean by last mile of care? This is where the care stops and the patients live, or the consumers live. So It's the neighborhoods that people live in. It's how do they access their primary care doc? How do they get to the hospital? How does the data exchange happen between a consumer and their physician? All of this is happening in what the industry is calling this last mile of care. And there's a lot of opportunity in the last mile of care. So there's three real big themes that kind of presented themselves at the conference, but then also we're seeing at other trends across the industry as well. The first is this corner clinic. As Hamid talked about, the social determinants of care really define who you are and how you are going to act from a health perspective. Where do you live? Who you're surrounded by? Where you work? This is all happening in your home, around your home, and that's why there's the rise of the corner clinic. And when I say clinic, I do mean that in a very liberal sense. That clinic can be your phone. It can be via telemedicine. It can be via text message to your doctor. And then what we saw too is it can really be in the pharmacy and your Walgreens, your CVS, your Rite Aid, and really understanding what the new front door to primary care looks like. What's going to happen to the primary care physician? We don't know. We can assume a couple of things, and we'll talk more about that in a second. But really, the corner clinic will redefine how consumers or patients get care and access care in the future. We heard at the conference from Rite Aid, from CVS, from Walgreens, on how pharmacists will become the new primary care physician. And I realize this is a really provocative statement. And as we're thinking about these blurry edges, of course, the PCP is not going away, but the PCP is going to be treating a lot of different conditions that maybe they weren't treating right now. So how does that consumer get care? How do they get more regular care versus episodic care? And it's that pharmacist who really, even Rite Aid is making a central part of their new business model to be out on the floor, talking to patients, offering recommendations, offering solutions, and being able to get more than that 0.1% of care, 1% of time in a patient's life that they're in their primary care doctor's office, and instead going in weekly to their Walgreens to pick up a snack or to pick up a prescription, or even just to pick up a gift card or something like that. So that's why pharmacists really are the new primary care physician. Okay, I have a question from Kevin. Thank you, Kevin. What is your feeling on innovation coming from big tech versus startups? With health tech startup funding up this year, what trends and themes do you see from that area? Also, what are the biggest that you see coming from the big tech firms? Thanks. We'll talk a lot about that. I don't know, Hamid, if you want to dive into that right now, or we'll get to that maybe on the integration slide.
Yeah, that was an awesome question. There's a whole that is actually a theme that's under our second undercurrent. So, Kevin, let's take a look at that in just a minute. With what we were talking about here, and speaking of big tech, I just wanted to interject something. When we're talking about, companies like Rite Aid and changing the way that the pharmacy is delivering care, they're also reimagining how that's done, right? So there's those blurry edges, like the boundaries of the quote unquote pharmacy are also changing, aren't they? Because of the whole digital, physical experience, blended experience. And, we heard that from all the major pharmacy chains that were talking about it.
We did. I believe the CEO of CVS called it multi-channel integrated health delivery. In CPG and consumer wellness, this is called the omni-channel experience. But, he's defining it, or they're defining it as this, and I wrote it down because it's a mouthful, multi-channel integrated health delivery. So wherever that's coming from. So, if a consumer wants to get care on their phone, in an office, this is really going to define the way that patients access care. And, it's happening right now because of the pandemic, but it will stay. Models are being built around it. On the next slide here in a second, I'll share a model of what Rite Aid's doing and how they've completely redesigned their store. Another point that we want to make about this improving access to care and really getting care in that last mile is that home is the health future. And we see this from a Denver perspective, with Dispatch Health receiving $138 million in funding this year. Being able to deliver healthcare at home is really going to improve access to care. It's going to improve health, but really it's showing the clinical efficacy too of care at home. Patients get to stay at home, get care. Elderly patients get to be treated at home versus in the hospital. And really this idea of home as the health future, it's not only something that companies like Dispatch Health are investing in, but also big systems like Humana, who's saying that the future of health is at home.
Kristin,
so a lot of traction there. Yeah.
Yeah, I believe it was the CEO of Dispatch Health who quoted that when you do post-operative recovery at home, you have a 20% lower mortality rate. That is so, the mortality rate post-operative is probably fairly low to begin with, but a 20% reduction is huge. And the only thing that you change is your environment. When you're home, that's where health happens. I thought that was really a critical aspect of things. So that last mile is really with the home being the epicenter. Yeah.
Exactly. So why should we care? If we want to go to the next slide. Actually, I'm jumping ahead here. I've talked a little bit about Rite Aid of the future. I know I talked a lot about that. So Rite Aid launched their redesign. One of the things that happens at health is that a lot of companies make big announcements in healthcare, and Rite Aid was not alone on this front. But what they've done and what they are planning to launch here in the next couple of months is a new store, a new framework. But not only did they relaunch their brand, they relaunched the entire experience, from store redesign to what they're actually all about. You can see on the left-hand side of the slide, they've redesigned their logo to be more traditional and more holistic compared to their competitors, to Walgreens and CVS. And they're really embracing the pharmacist at the core of this business model. Their pharmacists are going to be out walking the floors. They've talked about this lean process, that they're going to have more farm techs back behind the glass. Their pharmacists are going to be out walking around. You're going to be able to do a telehealth visit in the actual store. You're going to be able to get holistic medicine, not only traditional, but also sort of on the more Whole Foods-like experience really at Rite Aid, which other companies are not delivering. So we're excited to see this, especially since, the Rite Aids that I've been to in the past, I haven't had the best experience in. I'm sure you guys are all nodding along, but really their new stores, their new brand, their new messaging really looks authentic, and they've done a really great job with it. So now we'll talk about why you should care. And Peter, I see your question. I'll answer this in 1 second here. Thank you for that. What are the things that we can do to help our strategic plans today? What might we be thinking about? One question that Hamid and I thought about when we were having our brainstorm sessions about health on our walks around our neighborhood was really, how might consumer healthcare prepare for a transition to the neighborhood clinic? What might need to change in our business model? What resources might we be able to provide to the pharmacist? And then specifically, because home will be the center of care, how could an at-home diagnostics device really impact your business model? What are consumers wanting to test? Maybe they're not open to testing it right now themselves, but what does the future look like where you walk into someone's home and they know all of their stats? They know how much vitamin C they have. They know how they're feeling today, and it's because they've quantified themselves, and they're doing diagnostics in home. What if PCPs start treating even more conditions, including cancer? We talked about the role of the pharmacist in treating chronic conditions. What happens when PCPs are actually treating more serious diseases like cancer? And we'll talk more about how Dana-Farber is really going to play into that from an integration of care here in a second. And then what about the PCP? What about our physicians? Do they want to partner with pharmacists? Do they want this help? What's going to happen there from a behavioral perspective? We don't know.
There's a lot to this, what you just discussed. Like, for example, if I was a company in the life sciences and I'm thinking about moving into diagnostics, I've got some technology, you not only have to think about the analytes that you're testing, but also the form factor. that can really fit with, with an at-home diagnostics lab, which is the restroom, or, off the kitchen or something. And then how do you dispose of that? Where does the data go? How do you manage that data? And how do you make it so that, it's palatable by a much broader general lay audience? All of those are key questions that we think are going to really become at the epicenter of health moving forward.
Yeah, and that really pairs well with Peter Fox's question that he's asked, and how are these companies ensuring patient privacy and security with home health services? That is a big question, Peter, and we don't know. People are talking about it. I don't know, Hamid, if you have any more thoughts about that.
Well, I've got tons of thoughts.
I wish we could solve it. Yeah, you actually do have a lot of thoughts about it.
This one could be a whole other conversation that we would have, but I think there's a lot to that. The idea of security is really the counterpoint to the idea of trust. And so people don't actually care that much about their privacy or their security unless they sort of, get a whiff of mistrust, and then they care greatly about it. And so the question is, to your point, is how are these companies providing security, especially when you're talking about the data moving? Like, there's a big gap between what happens from my doctor's office to the pharmacy, and then there's even a bigger gap of what happens from pharmacy to home. And now if I'm talking about generating data at home as well, who manages all of that and how does it work? And I think that's the key, is really how do we engender trust in this new evolving health landscape so that doesn't become a determinant as to whether people use it or not. And how do we generate that trust? It's not just about providing security, although privacy and security are a key aspect of how we engender that trust. And also, and this is going to be signaling the next section, is who is at play here is going to be a big question.
Exactly. And another question around this idea of the corner clinic or the corner market is this idea that Peter brings up too, and the questions about the market for nurse practitioners and physician's assistants. I think there's going to be more demand. I mean, we can only anticipate the need for more of these types of practitioners in our current healthcare system. I could see the Rite Aids, the Walgreens, the CVSs of the world, the Targets of the world hiring NPs and PAs to be on staff full time, to be able to assist that pharmacist. That one pharmacist is going to be pretty busy if every single person is going to come with their questions as soon as they realize that they're such a trusted partner.
In all of these talks, Kristin, I sensed an underlying contention about the whole relationship between pharmacy or pharmacist and the PCP. I don't know if you probably picked it up too, where Rite Aid actually came straight out and said, we're not competing with a PCP, but others didn't say anything about it. And so the question is what is that relationship moving forward is going to be really key. It is kind of it's indisputable that people have many more touch points with a pharmacy or a pharmacist than they would with their PCP anyway. And so the frequency of care is really at play here.
Exactly. Oh, good. That was a great conversation around our first theme. The second theme that really rose to the top here is this idea of integration. And there could be, a whole conversation about integration. We've tried to summarize it in one slide for you, so bear with us. But really, there's this integration approach to delivering better care. And what we mean by that are really three things. First of all, and you can go to the next slide, ecosystem is really the new platform. Almost every single company, we should have had like a bingo going or something, Hamid, where if people said ecosystem, we could have checked it off. Because if it wasn't GE talking about an ecosystem that was delivering better clinical care, it was the likes of Philips, where Philips is partnering with Dana-Farber to deliver a system that is called the Philips Pathway System. And they're integrating data from research to patient data to reference data to really look at those clinical characteristics to determine therapeutic choice. So their model is being used at Dana-Farber, where many people are actually coming for second opinions on their cancer diagnosis, to really help them process the data, make better decisions about which drug is the right for each patient. Dana-Farber even said that they're delivering this or developing this platform so that your primary care doctor can treat your prostate cancer, can treat your breast cancer, and they're making it so that care for oncology is actually more democratized. So from an ecosystem, there are partners all in all different corners and areas of industries, and they're coming together to really deliver this better care. Which brings us to this next point, which is hello, care from everywhere and everyone. When I say care from everywhere and everyone, we're talking about companies like Comcast partnering with Quill to be able to deliver in-home care via your TV or via your phone or a digital assistant to be able to, help your elderly parents stay at home, and you're able to, as their children or other care providers want to check in on them, delivering care through their TV, through the ways that they're used to communicating or watching, will actually improve. But if Comcast is getting into healthcare, who's not, right? We see more traditional partnerships too, such as Livongo and Freestyle Abbott coming together to really understand and help patients with type 2 and type 1 diabetes get better care more quickly for their chronic disease. We also see companies coming together such as Kaiser and Cloud9. And Hamid, I know this was an area that you were pretty excited about. You want to talk about that integration or their partnership?
Yeah, absolutely. And this is actually goes into the third step as well, which is this personalization or sub segmentation. But it was really interesting. So I don't know if anybody knows who Cloud9 is on this call, but they're essentially a gaming platform. And so they are a network that allows for what's called esports. So essentially there's a whole spectator part of watching people do online gaming. And these happen to be, overwhelmingly in the Gen Z population. So these are, young adults, ages, I don't know if there's a lower limit to the age of, whether you can be on Cloud9 or not, but essentially they're young adults during their youth or early adulthood. And, and as Kristin and I also know, because we've done significant research on the Gen Z population, mental health is a really big part of their lives and part of their livelihood. And so now you've got these gamers who you would think, okay, they're spending all their time in front of a computer, they're lonely, they're loners, whatever. They're actually not. They're collaborating with each other, they're talking to each other. It's a whole community, it's a team mentality. And essentially, Cloud9 said, we've got this population. We know that mental health is a critical aspect of their well-being. Kaiser is really interested in understanding how to develop a series of interventions through delivering it through this crowd way, and then learning from what's working and what's not. It's a beautiful and really unorthodox, or not, not really one that you would think about. It doesn't really follow sort of the traditional orthodoxies of healthcare, but it's, from what they shared and the learnings that they're having are so powerful. And so that's the idea of these brands coming together and integrating together to deliver care to in this case, a specific population.
And I think, Kevin, this kind of answers your question too about trends with big tech partners. And I'll say Cloud9 is a big tech partner. I know it's not Amazon or Google, but they certainly have quite a big global audience, and them coming together with Kaiser, I think, is a really unique partnership to be able to understand mental health with gamers across the world, across the entire world. So really exciting opportunity there to take advantage of tech plus healthcare. Another idea that kind of rose to the top as Hamid and I were sort of discussing, what's important, right? And there's this idea of personalized medicine. It's more than genetics, it's more than therapeutics, it's more than diagnostic, but instead it's about really understanding your patient, understanding your consumer, and understanding how do you deliver better care to that whole person. An example of this, and Kevin, I'm going to link back to you here, with Maven Clinic. Up until last year, Maven was all focused on fertility. That was the only thing they were talking about last year at Health, was this idea to help women that are having issues with fertility. Now, they've taken that and expanded to be a business about family and helping parents get back to work and helping deliver their care. So they've sort of expanded their platform. They've made it more personalized to their customer, knowing that that customer has gone through their conception journey and now they have a family and they're trying to deliver that personalized experience for them. I thought that was a really great example. Hamid, I don't know if you want to talk about Geisinger or
yeah, sure.
in this situation here
Yeah,
too.
absolutely. I mean, part of this whole idea is, and if any of you on the call are, traditionally, come from a marketing background or a strategy background, the idea of customer segmentation and understanding your segment is nothing new. But in healthcare, there's been such a provider-driven perspective on health that they're just starting to understand and open the door to basically creating this whole idea of personalized care. So Geisinger, for example, was talking about how they're reimagining the primary care physician. So and the big thing is a Gen Z or a millennial has a very different set of needs and wants a different relationship with their healthcare provider than a boomer does, or a Gen Xer does, or and they're very different. And one of the areas that we challenged was, okay, so maybe you're unearthing something like this, and maybe those are universal anyway. Like, for example, somebody, one of the presenters said, a millennial doesn't want to pick up the phone and call a call center. And I'm like, hello, not a millennial, no interest in call centers, right? And so they're essentially using some of those ways of rolling out new ways of providing care. But I think the point here is that they're personalizing the care at least to subpopulation levels so that they can actually provide that. And, to your point, Kristin, it's much more about just like, when we hear personalized medicine, that term has been coined with this idea of, letting a patient's genetics decide what therapeutic is going to work for them. It's been reduced to that. But if we open the door to personalized care, there's so many environmental signals and there's so many like macro signals that we can take advantage of to deliver better care. And I think, this example of Geisinger or Kaiser Permanente or Maven Clinic are just all, within that realm of personalizing the way that care is delivered based on like just, gross macro understandings.
Yeah. Another question came in from Pamela about sort of the rural community and how do some of these in-home solutions, do they take into account that there are technology barriers? And Pamela, yes, I think that's a question the entire healthcare industry and also, wireless and broadband industry is trying to figure out. Dispatch is a in-person solution to delivering that on in-home care. And I think that companies like Comcast and Quest are trying to figure out how do we make rural connections stronger. And while it's not solvable yet, I do know that there was a big focus at health at the conference this year on the social determinants of care and how do we improve access to care for people that live in rural areas or areas that might not be easily accessible to technology.
One thing about this integration undercurrent that we noticed was that last year in 2019, when we went to health, a lot of companies were basically doing what if scenarios. Imagine that this is happening. Imagine that you go here and, and they were actually asking the audiences to really just sort of hallucinate this future. And many of them came back and said, here, we've made this integration and now we're delivering on that thing that we asked you to hallucinate about last year, and they're making it real. And so I think that to Pamela's point about the rural connection, because it was a topic that they were talking about, I think that there's, that's where there's going to be a focus moving forward as well.
Okay. So some questions to ask yourself about your strategic plans, about how you're sort of moving forward in your market. Hamid, I'm actually going to turn this over to you, if that's okay.
Absolutely. So, this goes to Peter's question as well. So, when we're talking about this whole continuum and this change and this integration, this is going to signal and drive major digital transformation in health. So, is not just about digitizing like little things. You know, we had even companies that talked about, pharma companies that are talking about how they're, you know, moving toward digitization of all of their clinical trials, how they're using machine learning and natural language processing to deliver better care. But, you know, what are also those data implications? So if you, for example, are a life science company that generates zeros and ones or data, what are the implications of that as it goes into the, you know, moves closer to health and moves closer to this personalized care? All of those are things that you need to be thinking about. But then also from a business model perspective, this is where we think that there's going to be a major, you know, pretty tectonic shift here, because you have, you know, we all as human beings make decisions by putting things in categories and buckets, right? Walgreens, pharmacy; Kaiser Permanente, care provider, or, you know, or insurer or whatever. Philips, my washing machine. You know, Amazon is where I get my, you know, household goods. Comcast, my healthcare provider. Like that becomes weird, right? And so there needs to be a real big, there is going to be a real big shift. And also within those categories, within those traditional categories, let's say you're a large company, and let's say you've enjoyed all of the benefits of having these really deep relationships with, say, the hospital system or the care provider, and you really, you know, use your size as a way of delivering better care and interest. And now you're sitting at the table, and your much smaller competitor shows up to the party with Amazon on their arm. Now you're the small fish, and they're the ones that are you know, really flexing their muscles. So Quill, nobody heard of Quill before, but they've got Comcast behind them, and that makes them a completely different animal to deal with. So it's not just a matter of what they're saying; who says it also makes a big difference. And so, you know, we heard a great talk by I believe he was the chief information officer of Novartis, and he was talking about how you know, he's come into Novartis and how he's seeing so much opportunity for digital transformation. You know, there are people who work at Amazon and Microsoft that go to work at Novartis every day right now. There's such a close-knit, badgeless collaboration between these teams that are really trying to solve this problem. Now, they become a really formidable competitor to somebody else. Now, Novartis is a large one, but, you know, I mean, I bet Microsoft has lots of deals with many of the smaller companies as well. And so there's going to be a reshaping of this business landscape. And so how does that actually change your strategic plan, you know, as far as how you might show up with your customers and your public?
Yeah. I was really inspired by that Novartis talk too, about the Novartis biome and what they were doing with Amazon and Google at their side. It was so inspiring to show the speed at which they were operating, and then their intent for innovation and you know, making their therapeutics better, making clinical trials better. It was really inspiring, and I think it'll be really neat to watch that sort of transpire.
No, you're absolutely right. You know, another, and you know, just to your point, they were also opening a front door based on their digital with Biome. You know, that there was basically it was an invitation for collaboration. So they were bringing ideas in, and essentially saying, look, we'll provide the data, we'll provide the digital infrastructure. You go and you know, innovate, and then we'll make it happen, which I thought was really refreshing as well. That was a really inspiring talk. You know, changing over the way that we're seeing some of these integrations happen, especially around, you know, the companies coming together either as a joint venture or working together on a different model. You know, we think that, you know, potentially these partnerships are the new M&A, and especially if you look at the valuation of the health tech industry, the valuations are so high that maybe companies are feeling less comfortable buying these small companies, but they're saying, look, let's just, you know, I've got access to data, you've got access to patients, so-and-so has access to capabilities, and then so-and-so has the money. Let's bring them all together. And those are the chains that we saw, like the Kaiser and Cloud9, right? Cloud9 has access to patients. Kaiser had everything else. They had the know-how, they had the data sets, and then, well, actually together they generated the data sets. They had the know-how and the money, and Cloud9 had the access to the patients, and together they generated novel data. And so we're seeing a lot of that happening, but it's all done through this idea of how do we fill the gaps in the health consumer journey. So, there's a real and, unmistakable pivot toward, sort of the health consumer as the central point of the future of healthcare, which I thought was really powerful. And then this last part really just again goes back to Peter's question about security and safety, and I sort of maybe pivoted it over to the whole trust question, and which of these collaborations are going to raise your suspicion, which ones are going to make you want to really dive in and ask that question. So when we were hearing, for example, the Quill Comcast, I sent a Slack message to Kristin that said, this is just like an inverse. This is an inverse business model of the home security system, and it seems really cool. There's ambient sensors in your phone and everything. And Kristin shot right back and said, I don't want Comcast watching my parents. And so that's where this whole conversation started. Is again, who says it matters? So so there is a big trust issue. We asked the question, like, and I'll ask it to you, our viewers. For example, if your bank used your bank records to give you health advice, would you find that weird, or would you welcome that? Some of you may be like, no, I totally welcome that, and some of you say, you stay away from putting those two things together. And so, but again,
I'm in the weird camp. Weird, definitely weird.
Weird, right? I mean,
I have a couple people say weird. Yes.
See what I mean?
But you never know. I was really impressed with the Bank of America CEO, so maybe not.
That was the thing. So Bank of America was there, and the CEO gave a really inspiring talk. But the talk was all about how they cared for their employees' health during the pandemic, right? Totally appropriate.
True.
We hearted them a lot in that conversation, and it wasn't weird at all. Like it was, But if they're now caring about my health, maybe considered weird. And so that's the balance of really the trust, the brand trust issue. And going back to Rite Aid, and you mentioned this several times, Kristin, about authenticity, right? I mean, do you want to talk about that? They did it well.
No, go for it. Yeah, I mean, we need to be authentic, right? And by being authentic, Rite Aid is a great example. I think they're training 6,500 of their pharmacists and their pharmacy techs and how to work with patients and be trained on all of the things that patients would talk about. So it's putting sort of those credibility proof points in place so that your brand can be authentic. We know that Gen Z will cancel you in a second if you're not authentic with them. We might have more patience at Gen X, but for the future of America and the world, really Gen Z is going to influence everything. So we need to be authentic.
Yeah, and that means listening, right? Insight generation and really listening and understanding segments based on behaviors, maybe. So.
Yeah, exactly.
Awesome.
Kevin had one more question. Thank you all so much for your participation. And then we'll move to talk about what the conference was like for us, because I know a few of you are really interested in knowing what the virtual conference experience is like. Kevin asked about the Cures Act and about interoperability. The requirement there will speed the adoption and create these ecosystems. And Kevin, I hope so. I really hope that whatever we can do will speed interoperability and be able to get people to work and companies to work so that data is integrated and more easily accessible so that we can make decisions and use that data to get better care.
And there were people talking about it. I mean, even the CEO of Epic talked about it.
Sure.
And we know that Redox is really into that. We know a lot of companies were talking about interoperability. Some companies are building their own systems and allowing for interoperability. A company like Olive talked about it. And so there is definitely a conversation around that. What's going to speed it up, though? I think a lot of folks are focusing on the whole compliance and policy issue, but nothing like a good pandemic to make people just put their orthodoxies aside and really head down a path for actually solving the problem. And we actually are seeing that that's happening. So Yeah, I'm with Kristin. I hope so too. So what was the experience like? I mean, this was I've certainly attended talks before online, maybe like this one or whatever, but what was a whole conference like? And that's something that, you know, again, many of our clients are asking us to help them envision the future of conferences, because so much money gets spent. And so this is basically, we spent our time in front of a computer more or less for almost 5 days. This is, you know, I'm just showing this to you. This was the interface. And this is what they showed. And you could actually click on the agenda and you could see, you know, the agenda of the talks, and then you could hit the play button and it would open up to a full screen. And then, you know, there'd be a discussion. There weren't as many sort of slide presentations as there were just conversations. And, you know, whether they were a single person announcing or having a discussion being moderated by someone. And there were weird time intervals. They were like, you know, 12:17 to 12:36, and then the next one would start, you know, moving forward from there. And so Kristin and I would log in. You know, we made a plan of what we were going to watch, and we would log in and, you know, more or less spend the day there. Do you want to share anything about like how we communicated or how that evolved?
You know, one of the things. Yeah, so one of the things that Hamid and I love about this conference is the inspiration, looking at the future of healthcare. And you miss, when you're in a virtual setting, you sort of miss that back and forth, that exchange that you have walking from one session to the other. So we immediately started a Slack channel, and we're just capturing all of our ideas there. But it was definitely hard to pay attention and to be focused on a conference when you weren't actually there in person. You know, I found great value in being able to watch a session later. If I had, you know, client engagement, I'm sure I was on the calls with many of you last week. I would watch a session later and then take notes in our Slack channel, and we'd be able to talk about it whenever was relevant.
There was also, you know, the health conference also had its own Slack channel that they had created. And so you could actually participate in conversations with other attendees or with a lot of the speakers and the announcements. They had a whole bunch of different, you know, hashtag channels on the side, and more were being added as topics came up. Like I was, you know, we're hiring right now. And so we asked them, you know, whether there was a career opportunities one, and they said no, but they created one within 10 minutes. And so, you know, we were able to post our open positions and, you know, going from there. And so it was really interesting to see how that entire conversation evolved. And moving forward, the other piece is like Kristin said. I mean, so one of the things I learned is so much nicer with a buddy, like with a colleague, to go, and even if it's virtual, even though, you know, Kristin was in her home and I was in my home, knowing that we were going through this experience together really enriched what we were taking in, I think, individually, or I was taking in individually. Whereas if I was doing it on my own, I may have sort of shifted in and out of interest, you know, a lot more than, so it allowed me to be much more engaged. I don't want to speak for you, to be much more engaged. Okay. And then, you know, knowing that we were not going to be going to dinner together or just walking around or whatever, we actually set aside time at the end of every day to connect with each other and talk about what we had learned, what we saw. You know, maybe she had gone to some meetings that I hadn't, or we were talking about some of these undercurrents that we were noticing, and that made the entire experience a lot more powerful. So, you know, I guess if there's one recommendation I would have to either the industry that puts on conferences, or if you're planning on attending a conference, I would say, you know, encourage group participation, because it makes it better for that group. There was great activities. There was great, there was really wonderful, you know, entertainment at the beginning of the day, midday, at the end of the day. And DJ Questlove did a 45-minute DJ session, and it was all around, you know, the donations, you know, collecting donations for the Health Foundation, which I thought was really powerful. And he's amazing, not only as a DJ and a musician, but as a human being. So just even knowing that he was participating was incredible. But, you know, there was the one part that was sort of left a little bit for improvement here, was around just the whole networking and the whole exhibit hall session, we believe that there's a lot of room for, additional innovation just within the overall conference, world, as it were. It's, the vast majority of it is just reimagining the physicality of a trade show or an exhibit hall, and that's just not how it works online. We didn't find, again, I don't want to speak for you, I didn't find any value. I found it hard to participate. I found it hard to engage. There were little tiny commercials before every single meeting though, and those were awesome. I mean, the quality of those commercials was really, really high and really awesome. But the networking aspect of it, I think there's a lot more that they could have done.
Agree.
Excellent. Well, we are, we've got 10 more minutes, but we certainly don't necessarily want to hold you hostage to those 10 minutes. If you have other questions or want to discuss any aspect of what we learned, please put a question into the Q&A box, and we're happy to engage with you on it.
I don't see any more questions coming in, but we'll just give it a minute here.
Absolutely.
We'd love to chat. If you want to talk about anything in the future, this is how to reach us. And thanks for joining us.
Excellent. Okay. Well, I think we'll end it there. Thank you so much. Yeah, thank you so much for your participation. Kristin, always lovely to talk with you. And thank you for those of you who attended. Thank you for those of you who asked the questions. And we look forward to seeing you again soon.
Bye.
Bye.